Here we are on the second part of the tale. The big boy from upstate New York, born 1 year before me, 1950. 10 years ago, even before I had my calcium score, he had a calcium score in 1998. It was 210. Apparently this put him at the 94th risk percentile for having an event. He was treated to goal on the LDL 68. However, his triglycerides were high, 299, and this is surprising since apparently he was on 2 grams of niacin and Tricor. However, I don't know why I am not told he was on Lovaza, which is fish oil. His HDL was 37 and not at goal. Again, if this could have been encouraged in terms of more vigorous exercise on a daily basis, and perhaps making sure that he was compliant with the Tricor and niacin. All these things help raise the HDL. But I think what helped me, other than being ApoE4, is the fact that I was on Actos. Now, this patient must have had metabolic syndrome, possibly had diabetes. A very aggressive person might have added Actos, and this would have raised his HDL. Actos in the Chicago trial was shown to reverse plaque as well. Again, I am giving the most aggressive approach, which is off-label. But what is important to know is that 3 goals were not met in this patient, and this is not knowing his glucose level. Triglycerides were high, HDL was low, and his non-HDL cholesterol was not at goal. Thus, this patient's particle number would have been very helpful. If we knew his LDL particle number was above 750, he would have done well to switch from Lipitor to Crestor. And perhaps once his triglycerides were under control, adding on Welchol. Thus, there are some questions about the upstate boy. Inflammation is obviously what killed him. He had small plaque because his stress test was negative, less than 70%, but it's this soft, small plaque that usually ruptures. Apparently, he had a normal C-reactive protein high sensitivity. However, I believe LP plaque is more specific, and perhaps if that was done, it would have alerted everyone to the fact that inflammation was going on. Fish oil added to statins does lower inflammation by 78%. Still, stress test is to evaluate chest pain. Sometimes it's used to evaluate starting an exercise program if one is already not being engaged in. To do a nuclear stress test in someone who's asymptomatic seems a great waste of resources to me, and instead a calcium score follow-up could have been done, a CIMT of the carotids could have been done. If his calcium score had gone up to 500, maybe he would have lost 80 pounds. That's the beauty of these tests, is that they engage and empower the patient to take responsibility and to start to do something more for their health. The moral of the tale: don't put a patient on autopilot after you put them on a statin. Nuclear stress test evaluates chest pain. Inflammation matters. Check LP plaque. Fish oil, look at the back of the bottle, DHA, EPA, not the front of the bottle, and make sure you are taking 850 milligrams at least for everyone. The Jealous trial showed people in Japan who take quite a bit of fish daily still enjoyed decreased sudden death when they added on fish oil tablets. Do CIMT for plaque progression or regression, and most importantly, get LDL particle number instead of plain LDL direct. Most people are getting LDL calculated, which is even worse. Try to get the HDL over 50, but I wouldn't go much higher than that as that is usually sufficient. Thank you very much.